Hello, very nice to see you. Can I get your first and last name, please? And this is your first time at the OBGYNs? Okay. Under 18, correct? Are you having any concerns today at all? Mom made you come in? Gotcha. I can tell you are a little bit nervous, but I can assure you that anything you weren't expecting or anything that you do not want, we will not do. So let me ask you a few questions. I'm going to get your vital signs, and then the provider will be in to talk to you. All right. Any medical conditions that I should be aware of? Okay. But no history of blood clots or... Okay. Any surgeries? No. Do you smoke or drink at all, whether it's marijuana, cigarettes? Okay. All right. Any family history of breast, ovarian, or uterine cancer? Okay. What side of the family? And do you know roughly how old they are? They were when they were diagnosed? Okay. Now, I have a kind of personal question. Have you ever been sexually active before? So not currently, but okay. And as far as sexual partners, male, female, both? Okay. And did you use protection when you were active? And was that always or kind of on and off? Okay. Are you on any forms of birth control, whether that be hormonal or non-hormonal? Okay. Very good. All right, if it's okay with you, I'm just going to take your vitals before the provider comes in. Yes, okay, good. So first, we're just gonna get a temperature check. And when was the first day of your last menstrual period? About a week ago. Oh no, not at all. So if you are not comfortable with any certain exam, you would just let us know. We can never force you to do anything that you're not comfortable with. Yes, especially if you weren't expecting it. Because that is not cool. All right, this is going to go under your tongue. If you could lift up. Okay, I'm going to keep it there for a few seconds. Very good. I'm gonna put this away. Then we'll just get your blood pressure. You're not having any fever, chills, nothing like that, right? All right. I'm gonna close this up. All right. If you could rest your arm for me. Perfect. We're just going to have this machine read it here, but I will take the cuff and wrap it around you. Does that feel snug? Good. All right. Perfect. Blood pressure is 110/72. That's very good. Okay. Are you having any urinary symptoms at all today? Anything you want us to screen through your urine or no? Okay, good. Alright, so I don't think we'll need then a urine sample from you, at least for right now. What I am going to do is I am going to have you stay seated in this room. You can totally stay dressed. The provider will come in and you guys can kind of talk about, at least get established with someone. And if there's anything you want to discuss with them or any testing you want, you can kind of always figure that out there. Absolutely. It was very nice to meet you. The provider will be in shortly. No problem. See ya. I'm coming in. Hello. It's nice to meet you as well. My name is Leanna and I'm a PA that's going to be seeing you today. I understand that this is your first time at the OBGYNs. Okay, under 18, so it looks like mom made you come in. That's usually how it is for most people. Yes. All right. I took a look at all of your medical history, surgical history. I know, it wasn't that long ago since you've seen your primary care doctor and pediatrician, it looks like. Okay. Now, are you having absolutely any concerns at all today? Okay. People your age will typically book appointments to the OBGYN if they are having any issues with their menstrual cycle, period pains, birth control consults, STI checks, just to rule out infection. Some people will also come in for annuals where they would get a breast exam, abdominal exam, pelvic exam, if they so desire, even if they're not having symptoms. Now, because you are not 21, we do not need to start cervical cancer screening at this time, but something to definitely talk about when you do turn 21. Do you know what sort of, did you want an annual today where we do like a breast exam, we'll do an abdominal exam, and I know you're not having symptoms down there, but we can always do the pelvic exam, which consists of me looking on the outside to make sure there's no suspicious moles or lesions. We can also put a speculum in to make sure that the inside of the vagina looks healthy. So it's totally up to you. Okay, so you want some STI screening today. Okay. Look on the outside, but you don't want anything going in. Okay. And you're not having symptoms down there, correct? Okay, good. So how about this then? How about I have you leave me a urine sample. We can screen for the STIs off of here since you don't want anything getting inserted in there. And then we will screen you for that. We can order blood work if you're interested. Yes, the blood work would be hepatitis, syphilis, and HIV. The urine would be gonorrhea, chlamydia, and shrink. Okay. I'll do that then. And then I will give you some privacy. You'll leave me the urine sample. You'll come back in here and you can keep your t-shirt on. Just take off your bra underneath. And then I'm just going to do a quick abdominal exam. We'll look on the outside, so you'll get undressed waist down. But as your preference, we will not put anything in. Absolutely. Okay, so I will give you some privacy. Leave me the urine sample and we'll be back in for the exam. Perfect. All right, I will be back. Alrighty, are you ready for the breast exam? Okay, good. You let me know if you're ever uncomfortable. Absolutely. We encourage monthly self-breast exams just so you become familiar with what your normal breast tissue feels like. I'm just going to lift your shirt up. Perfect. And then you feel my hands. Excellent. And you, of course, have never noticed brown discharge of a nipple or any skin changes? Okay, next breast. Okay. First exam is normal. I'm going to press on your belly now. No burning when you pee or peeing too much. Perfect. Okay. Let me help you sit up here. Let me grab something. Give me 1 second. And help you sit up here. I'm just going to move the pillow. Just going to move some of this down. Alright. You feeling okay? Good. Let me fix this here. Okay. If you wouldn't mind scooting a little bit more. Perfect. And I am just bringing over a light to get a better look. I'm going to take the stirrups out. You'll put 1 foot in each. Yep. Perfect. All right. You're only going to feel my gloves on the outside. Absolutely nothing is going in as you requested. Perfect. You let me know if you're too uncomfortable. Yep. All right. Doing okay? Good. Outside exam is normal. Oh, you wanted me to show you what a speculum looks like? Yes, of course. Now, speculums, they come in various sizes. So we would start with a smaller size. There are pediatric speculums. And then there are smaller and longer. They also come in various widths as well. Yep. So the way it would work essentially is we would take the speculum, put some warm water, lubricant, and then we would insert it into the vagina. We would then, to look in the vagina, open it up, lock it in place, just to kind of see everything internally. Yes, once we saw everything, we pull it out and then you're done. Yes. Still don't want it? I don't blame you. I don't blame you. You know, as long as you're not having any symptoms, yeah, it's totally okay. All right, but I'm very glad that you asked. You are all done with this part of the examination. I will, of course, call you if your urine or blood work comes back positive. I hope this experience was not too much for you. And I encourage that, you come routinely for checkups, especially if there's any new sexual partners or you didn't use protection. Absolutely. If you have any concerns or any questions, you would just let me know. Yes, I am just a call away. Let me give you some privacy, and the girls up front will see you for checkout. It was nice to meet you as well. You have a good day.